Transcranial Magnetic Stimulations, Chapters 1 through 5 presentation by Patricia Torres, BSN, DMP student. Committee overseeing the project. The organization that will be overseeing my project is Maryville University, which is overseen by the program director, the chairperson, and the mentor. The organization that is working alongside Maryville University is Sunrise Neurobehavioral Center, whose practice owner assigned a preceptor who agreed to oversee the project. Background of transcranial magnetic stimulation. The concept of TMS focuses on providing patients with an alternative therapy for treating major depressive disorder when they are resistant to antidepressant treatments. The concept of TMS is tied to the fundamentals of physical chemistry as it is underpinned by inducive effects. The inducive effects of TMS are essential to the functionality as the inducive effects play a key role in electrical currents that travel within the brain, essentially using magnetic fields that are generated with the device. The concept of TMS was founded by Anthony Barker in 1985 with his and the support of electrical fields using Michael Faraday's principles on this topic, which has proven to be the foundational to the success of TMS. Essentially, the patient's neurons are targeted in this stimulative technique to induce depolarization of neurons, which not only regulates the brain functionality, but also secretes neurotransmitters that are essential for regulating the brain function. The neurotransmitters are generally released during depolarization of these neurons are three transmitters associated with brain functionality: serotonin, dopamine, and norepinephrine. It is essential to understand how this non-invasive technique can be pivotal for treating patients with major depressive disorder that is resistant to antidepressive treatments. Review of literature. The goal of the scholarly project revolves around three themes, which is patients who experience remission or an improvement in symptoms, which leads to a third theme, their satisfaction of life. First theme, remission. The first theme discussed in remission, and it is selected because this is the ideal goal for patients to reach a stage of treatment that migrates with their symptoms entirely. The concept of remission and TMS have been investigated for the past decade, yielding promising results for patients that up to 63.6% of the patients may experience remission after 4 weeks of therapy by Yeep to 2017. Colony 2012 explains that 24.7% of patients in their study experiences remission at 6-week mark, while NextU 2018 explains that around 20 to 30% of the patients will experience remission. It is worth noting that the concept of remission has been expressed as of solved symptoms equivalent to the patients taking antidepressants, but with less side effects. Second theme, improvement in symptoms. Therefore, a patient's improvement in symptoms is the second theme noted from the collection and analysis of the data. Risv and Clan discuss how TMS has lasting effects on the patients as their research explored how patients respond to this treatment and whether the improvement of moods were sustained or flattened. Lastly, effects are crucial as it can be a determinant factor in the patients who desire to pursue this alternative treatment because of improvement mood means migration of symptoms for the major depressive disorder. Furthermore, in a 6-week trial, 301 unmedicated patients were randomized into groups to determine the effectiveness of TMS and the lasting effects, yielding promising results after a 24-week follow-up by Sun 2014. Third theme, satisfaction of life. Satisfaction is an imperative concept to discuss because it shows that treatment was effective in a way that yields an improvement in their overall life after receiving TMS. If the patients can feel improvement in their overall life, then a milestone for TMS will have been achieved. The concept of satisfaction is subjective, but it can be objectively measured in scales such as the health-related quality of life scale, the quality of life enjoyment and satisfaction questionnaire, or the satisfaction with life scale. The theoretical framework. Although there are theories developed to help streamline research projects such as the Pender's model or the schematic model, the one that resonates best with this capstone project is the Newman system model. The Newman system model is a nursing theory based on individuals' relationship to stress, the reaction to it, and the reconciliation factors that are dynamic in nature. The Newman system model was developed by Betty Newman, a community health nurse, professor, and counselor who focused on yielding positive patient outcomes. The basis of this theoretical framework is that the client is the open system response to stressors in the environment. The client has variables that must be taken into consideration, such as the psychological, social culture, developmental, and spiritual, and psychological, physiological. The elements can play an intricate role in the patient's well-being and the physiological aspect of both, which resonates to the core of this project. The goal of this system model is aimed to stabilizing the client system that is achieved through nursing intervention and reduction of stressors, which is accomplished with nursing diagnosis, nursing goals, and the nursing outcome. Methodology and research design. The research will be conducted in a private practice that is currently evaluating, caring for, and treating patients with TMS. The research will anticipate 6 participants, as the research will focus on the patients who have not received TMS in the past or are currently receiving TMS, and were referred and approved by their provider. The participants' demographics will not be collected in this research, such as ethnicity, race, belief, or information not relevant to their depression and satisfaction with their current life. There are 2 research questions that will be explored in the Scholarly project. Research question 1. Does transcranial magnetic stimulation lead to the satisfaction of life experiencing major depressive disorder and treatment resistant? Question 2. Is transcranial magnetic stimulation the best alternative treatment of choice for patients in this population? Methodology and research design. Research design. The project will be used quasi-experimental study design. The cause and effect relationship will be explored is that TMS improves patient satisfaction with life. Statistical analysis technique known as the Wilcox-signed brain test through the statistical package of social science program. Inclusion criteria must be 18 years or older, have been diagnosed with major depressive disorder, have experienced treatment resistant, never received TMS, or people who speak English or Spanish. Exclusion criteria: under the age of 18 or over the age of 90 years old. Successful patient pharmacology intervention and not tried outpatient pharmacology. Sampling. I use simple random sampling, which involved gathering a small cohort of participants and randomly selecting 6 of them to participate in the study. Gathered from a pool of participants who applied to be in the program, only 6 were gathered for the study. Has a satisfaction of statistical power of 80% with a sample size of 28. 6 participants from a small private practice. Each participant answered 5 questions from the satisfaction of life. 6 participants answering 5 questions, which each increased the sample size to 30. Data analyzed. The statistics were broken down into 2 portions: the overall project statistics and the Wilcoxon sign ring test. The overall project descriptive statistics were divided into pre-test and post-test, which consist of a sample size of 30. The pre-test has a meaning of 1.400, a medium of 1.000, and a mode of 2.000, with a standard deviation of 0.49827 and a variation of 0.24827. The post-test has a meaning of 3.900, medium of 4.000, a mode of 2.00, and a standard deviation was 1.91815 and a variation of 3.67930. The frequency of distribution was not present in the SPSS descriptive statistics with the Wilcoxon signed ring test. Data analysis continued. The next portion of the descriptive statistics in the Wilcoxon signed and ring test. The Wilcoxon signed ring test provides metrics on the rings as well as test statistics. The rings seen in Table 2 demonstrate the pre- and post-test and the mean rank difference, which can be seen as 11.50 with a sum of rankings of being 250.0. Table 3 indicates the test statistics, which illustrates the difference in groups' overall population mean. Table 3 demonstrates a z-value, which is -4138, and indicates the two-tailed is 0.000. Results. There were a statistical significance between the pre-test and the post-test for the participants undergoing transcranial magnetic stimulation to manage their resistant treatment depression. The Wilcoxon sign ring demonstrated that the pre-test has a meaning of 1.400 with a standard deviation of 0.49827, and the post-test has a meaning of 3.9000 with a standard deviation is 1.918.5. There is a clear indication from the Wilcoxon sign ring test that there is a standard statistical significance demonstrated by the z-value, which is -4.138, and indicates a two-tail n is p 0.000. The takeaway from the results indicate that TMS should be used, as this leads to improvement in patient satisfaction of life based on statistical testing. Limitations. The limited number of participants was a large limiting factor for this test study, which could be connected to bias imperfections as well as generalization of study results. Another limitation that could be questioned is the duration of the study and the use of control groups such as people who were not given TMS. There is no bias in the study such as recall, selection, and information bias. The information that was given to participants was also given to the IRB and the chair, which outlined the study and which would be performed and asked of each participant. Recall bias was addressed because the participants that were tested pre-TMS and post-TMS. There was no selective bias as participants were selected at random. The only information that was collected as a patient was the patient and their scores of pre and post tests, leaving the room for discrepancies regarding such as race, ethnicity, gender, and what other potential demographic factors that may influence the study. Further testing will have to be performed in prospective cohort study to determine the sustainability beyond the 8 to 10 weeks of testing. The effects of limitations limitations led to limiting the generalizability of results as well as a finding and their validity, leaving this quality improvement initiative to be further investigated by other researchers. Discussion. Post-implementation insights. The barriers were defined as something that restricts or impedes the progress or outcome of the study. The facilitators were described as something that reduces barriers to promote the progress or implementation of the study. Barriers. There were some barriers identified in this quality improvement initiative, including restrictive eligibility criteria, the lack of time, the lack of awareness, and the insufficient participation. Another barrier was the participant awareness and those who participated in the study, which was difficult to address due to the time restraint regarding the duration of the project. Facilitators. There were some facilitators to this research, which included the Maryville IRB, the staff to help guide the quality of improvement study, as well as computing the statistic findings. Maryville staff played an essential facilitator part in leadership, protocol development, as well as resource attainment and time management. Another facilitator in this quality improvement initiative was a public use for the satisfaction of life skills utilized within the project. Private practice also played a role in the facilitation of the research implementation and the quality improvement projects to further demonstrate the effectiveness of TMS for the patients experiencing resistant treatment depression. Implications for practice. The implications for practice and further research, as well as healthcare policy and the quality of safety for patients, is to consider the useful transcranial magnetic stimulation as a method of treating patients with resistant treatment depression. The base of this project was to evaluate the current practice of resistant treatment depression, as well as the quality of life for patients experiencing this disorder or undergoing TMS. The implications of the study clearly defined how TMS can be for patients who have failed outpatient therapy and are left with retrying pharmacological interventions to remediate their symptoms. The statistical significance of this implementation continues to demonstrate the validity of this project and how it can be used for patients for 8 to 10 weeks and improve their symptoms. The study results also imply that the healthcare guidelines on the depression should be introducing the use of TMS and how it can be essential for patients that have otherwise been unable to receive relief of their symptoms. The study did not evaluate the safety for these patients, as the project only focused on the satisfaction of life pre and post TMS, and not whether the TMS was deemed as safe for treatment option. This is for other research and other studies. Conclusion. The essential of this quality improvement initiative found that TMS, which is transcranial magnetic stimulation, improves patient satisfaction with life based on pre and post tests that were administered pre and post at the TMS at Sun Behavioral Neurobehavioral. The next step for this research is to further evaluate patients in prospective cohort study follow-ups with patients in the future to determine if TMS demonstrates sustainability with results, and the patient satisfaction of life continues beyond the small project. These findings can impact how patients receive care going forward as well, because the research statistically supports how TMS improves the patient's satisfaction of life with their overall 8 to 10 week period. Thank you for listening and watching the presentation on transcranial magnetic stimulation and how it can improve a patient's satisfaction of life. Any questions? These are the references. And this next page also consists of references.